Good morning, everybody. Welcome to our presentation talking about ARTA's Benefit Plans update. I'll go through a number of topics today. I hope you find it beneficial for you and that you go away with an understanding of the changes that we're making effective November 1st, be they plan design changes or rate changes. My name is Gary Sawatzky. I'm the COO of the Alberta Retired Teachers Association. I wanted to let you know that the session is being recorded and will be posted to ARTA's YouTube channel. So if you want to watch it again, you certainly can do that. Because it's being recorded, your video and microphone have been disabled in Zoom for your privacy. So you will not be showing up in that YouTube video. And if you do have any questions, please do not use the chat box in Zoom. Click on the Q&A button instead. I'm being joined today by Jennifer Hope, ARTA's Manager of Marketing and Promotions, and we will be answering any questions that come up during the presentation. So if you do have a question, click on the Q&A button in Zoom, type your question in there, and one of us will be getting back to you. We'll also stick around on the line after the presentation is over if you do think of a question, so that you can type it in at that time, and we will answer all of the questions that come in before we leave. So we're going to talk about a number of things today. Most of these items are those which have been affecting ARTA and the marketplace as a whole. We'll talk about the prevalent health states that are currently driving extended healthcare costs, the prescription drugs landscape, which is a direct effect of those prevalent health states affecting EHC. We'll look at ARTA's health and dental claims experience, and that is the claims experience which is driving rate increases this coming November 1st. We'll look at the plan design changes that were implemented, recommended to the ARTA Board of Directors by the ARTA Health Benefits Committee and accepted. So we'll talk about those, and we'll let you know what our marketing team is doing with regard to websites and other marketing initiatives. So first, moving into the prevalent health states. Based on our claims experience, we can see that costs for diabetes increased by 19.8% in 2022. That was driven primarily by the flash blood glucose monitor supplies. Those are the Freestyle Libre that you've probably seen, or perhaps you know somebody who uses them. For those of you who don't know what they are, it's a sensor that attaches to the back of your arm and allows you to determine what your blood glucose levels are in real time. You can hold up a reader to it or even your phone, and it'll tell you what your blood glucose levels are. That's a much better technology than was used prior with the finger pricks and the test strips. The only thing is the flash blood glucose monitors cost on average about 5 times more than the test strips, and more people are starting to use them. They're realizing the benefit that the flash blood glucose monitors bring, and as a result, costs have been increasing, as we see, by almost 20% in 1 year. And so that is certainly one of the drivers in increased claims costs over the past year. The next largest increase we saw last year was for infection prevention. In other words, vaccines. They went up by 46.4% year over year, and we're now paying about $1 million toward those products. The largest component of the infection prevention claims are for Shingrix. Shingrix is the shingles vaccination. And as anybody who has ever had shingles will tell you, shingles is not fun. It is an extremely painful affliction. Shingrix is very effective, over 95% effective, and it's recommended for anybody age 55 and over. And so if you are 55 and over, it's recommended you get the shingles vaccination in order to prevent getting shingles later on. Shingrix is not inexpensive. It's between $160 and $180 per shot, and the public plans don't cover any of those costs. It is borne entirely by the benefits plan at 80%. And so those costs can add up, And plus, you don't take just one shot, you actually need 2 shots to actually be effective. The next highest vaccine spend was on Prevnar 20. And if you haven't heard of that, it's a relatively new vaccine used to prevent pneumonia and other related infections. And obesity is the next highest claimed item. We know that obesity is a bit of an endemic in the current population in North America, especially, and around the world. And when somebody is obese, it increases the risk of other serious chronic illnesses, such as heart disease, cancer, stroke, diabetes, and non-alcoholic fatty liver disease. That means that people who are obese are most likely to be going to taking other medications for things like blood pressure, diabetes, and in some cases, depression. When there are new technologies available in the marketplace, such as what is happening right now, we know that drives up costs for claims as well. One of those items now is a new, or relatively new, anti-diabetic medication called Ozempic. Ozempic is used to treat diabetes, but one of the side effects of Ozempic is weight loss. And so a lot of people who are eligible to take Ozempic have been asking their doctor to move from their current regimen for treating diabetes over to Ozempic, realizing that they could also lose weight. And that Ozempic medicinal ingredient included in it is called semaglutide. That is actually being released right now specifically for weight loss. That drug is called Wegovy. It's been approved by Health Canada specifically for the treatment of weight loss. That happened in 2021, and it was expected to be available in 2022, but the demand for it is so high that they have not been able to actually stock it in Canada. But people realize that Ozempic has the exact same medicinal ingredient and are therefore moving to Ozempic when they have diabetes in order to try to lose some weight. A lot of us have probably seen the advertisements for Ozempic. We can't advertise very much in Canada when it comes to prescription drugs, but we have a flash on the screen and it just says, Ozempic, ask your doctor. Well, those advertisements have been very effective, and as a result, it's led to a shortage of Ozempic now being available in the marketplace. And we can see the effects on the ARTA Benefits Plan for those top 3 pharmacy claimed items. The Freestyle Libre sensors, for the flash blood glucose monitors, the Shingrix vaccination, and Ozempic now account for the top 3 items by dollar spend in the benefits plan. And just those 3 items accounted for almost 11.5% of ARTA's total spend for the first 6 months of 2023. And we can see that in the experience. The blue bar shows the deposits that are made in the plan, so the premiums that are paid. The red bar shows the claims, and those correspond with the left-hand side of the chart. The green line is the net loss ratio. That is the ratio between the deposits and the paid claims. When we're at 100%, then we know that for every dollar being paid into the plan, we're spending $1 in claims. But if we are over 100%, then we know that we're actually spending more on claims than we're bringing into the plan in premiums. And therefore, that results in us having to increase the premiums, such as we are doing starting November 1st. Extended healthcare is not in very bad shape. At 105%, that's very close in line with what we would expect for the consumer price index for medical items year over year. And so we can expect an increase like that. The scary chart that I'm about to show you is dental care. Dental care is running at about 125% loss ratio. That means for every dollar spent in premiums in the plan, we're spending $1.25 in paid claims. And I'm going to spend a fair bit of time explaining why that has come to be. One of the reasons is back here in 2020. We can see that claims were very low in that year. As we know, that was the peak pandemic years, and for whatever reason, people didn't want to go to the dentist and have them sticking their fingers in their mouths because that's how you get COVID. So a lot of people neglected going to the dentist for a year, sometimes even 2 years. And so they weren't looking after their teeth the way they otherwise would have been by going for examinations, basic and preventative dental care. And that resulted in people now having to get major services done to their teeth. Because there was that neglect, now they have to go in for root canals, or in some cases, prosthodontics. They have to get dentures. And all of those major services cost way more than the basic and preventative services. And as a result, that contributed to much higher claims being made for dental care services. However, the next factor affecting the dental care is the procedure prices themselves. This chart shows a 1-year increase for 2023 to the Provincial Dental Association fee guides across Canada. And have a look at some of the numbers in here. At 6%, Alberta is actually below average compared to a lot of the other provinces. Ontario had an 8.5% increase. Quebec implemented a 9.8% increase. Newfoundland and Labrador increased their fees by 8.5%. The average increase across Canada was 6.89%. This is by far the highest increases that have ever been experienced in Canada, and far beyond what we would have expected. As a matter of fact, the media finally got behind what was happening with dental care costs. And here's a headline from the Globe and Mail from last month, talking about how dental costs are soaring across Canada with those increases to the fee guides. This is a really good article, but I don't think it spent enough time talking about the background and how people were not looking after their teeth during COVID. They now need those major services done to their teeth. And so those two things are compounding. And as a result, the actual cost increases are going up across Canada anywhere between 15 and 25%. And in Alberta, we really didn't expect that 1-year increase of 6%. To give you a little bit of history, the ADA published a fee guide in 1997 and then went 20 years without a fee guide. They let the dentists determine what the marketplace would bear and allowed them to charge whatever they wanted without a suggested base to use as what they would charge for their patients. The government became aware of the significantly increasing dental care costs during that time. Alberta had by far the highest dental costs in North America by 2018. And so the Alberta government worked with the Alberta Dental Association in order to implement a new fee guide. And that new fee guide was introduced in 2018. It paid on average 8.5% lower than what was being charged in the marketplace at that time. In 2019, the ADA didn't change their fee guide. They simply changed the year on the cover, but left all of the procedure rates exactly the same as they were prior. In 2020, there was an increase of 4.4%. So that's about double what we would normally expect, but it makes sense because they're also making up for the year in which no change was made. In 2021, they did the exact same thing as 2019. They used the previous year's fee guide, changed the year on the cover, and didn't change any of the rates. And in 2022, again, they made up for the year in which no change was made, and they had a 2-year increase of 3.9%. So when we were looking at the rates last year, we thought the ADA is most likely going to use the same pattern that they were using up to that point. And lo and behold, they didn't. They joined all of the other dental associations with a very significant rate increase at 6%. And as any dental association will tell you, these are still only suggested rates. Dentists don't need to follow the ADA fee guide. They're still free to charge whatever they want. These are only suggested fee guides. And at the last study that was done last year, it was determined that only about 40% of dentists in Alberta were actually following the ADA fee guide. Now, there's another factor that's occurring in the marketplace right now in the Canada Dental Benefit that's being provided to low-income Canadians. That benefit provides a flat dollar amount to low-income Canadians in order to access dental benefits. It's a fantastic plan and one which should have been implemented a long time ago. But it's adding a lot of money to the dental marketplace. The last numbers that were quoted by the government in their most recent budget were $15 billion over 5 years. And they're not making a lot of new dentists. It's increasing the demand because people have access to dental benefits now, but the supply of dentists is staying the same. When you increase the demand but don't change the supply, that has obvious upward pressure on prices associated for those services. And so we have all of these multiplying factors that are all coming together. And as a result, the dental fees in Canada are increasing faster than any other point we've seen thus far. So talking about plan changes that we're implementing starting November 1st. The first is virtual physician services provided by Maple Inc. A virtual physician service is exactly what it sounds like. You can be sitting at your computer or on your phone or on your iPad. You can click a button, and within typically about 10 minutes, you can be connected to a physician. This is for your convenience. You could be sitting in your living room and you could have something that you may want diagnosed, or you may have realized you're running out of prescription drugs and you can't get in to see your doctor for a month. You can click the button and be connected with a physician within your province of residence. And that physician can diagnose your ailment. They can prescribe medication. They can order a requisite for tests for you. All of it without you having to go into a physician's office, or in some cases, a hospital emergency room. These are not meant to replace your family physician. We still feel strongly you should be meeting with your own family physician regularly. But if it's minus 40 outside and you need medications, this is a really handy way to connect you virtually over the internet with another physician. And those physicians, because they are practicing physicians within your province of residence, all have access to your medical records. So they have access to, in Alberta CareNet, they can see your medical history, what drugs you are taking, and any other diagnoses that you may have had in the past. The next change is we're implementing enhanced generic substitution for brand name medications, which have a generic medication available. ARTA currently has a least cost alternative provision, which states that if a brand name drug has a generic medication available, we are only going to pay up to that generic medication price. That's because we know that generic medications are bioequivalent. They literally contain the exact same medicinal ingredient within the generic medication, but that only applies to drugs listed in the Alberta Drug Benefit List. And that's the list that dictates what's covered through public plans, such as the Alberta Healthcare Plan for Seniors. With any other brand name drug, which is not listed in the Alberta Drug Benefit List, if it has a generic equivalent available, we're currently paying up to the brand name drug. And so in order to save the plan some money and ensure its long-term sustainability, we are changing to only pay up to the generic price for drugs also not listed in the Alberta Drug Benefit List. We're updating our dental care for people who have underlying health conditions who need to have additional units of dental cleaning. In some cases, a physician may have told a person that they are at a very high risk for infection because they are undergoing current medical treatment. And therefore, one of the ways to prevent that is by ensuring your teeth are very clean. And that means going to the dentist for even more cleaning than we currently provide. So if your physician has indicated that you need that additional scaling, they can provide a special authorization to ARTA, and we will provide up to 10 more units of scaling for a person undergoing those medical conditions who has those underlying health conditions. We're adding weight loss medications. As we mentioned, weight loss medications are really coming to the forefront of prescription drugs in the marketplace, especially with some of the new breakthrough medications for things like Wegovy or Mounjaro entering the marketplace. And so we're adding weight loss medications to the list of lifestyle medications currently covered under the HealthWise Plus and Ultimate Health plans. Those plans currently cover hair loss and erectile dysfunction medications, and we're adding weight loss to those categories as well. Every year, we update our usual and customary charges. We want to ensure that we are paying out according to what is being charged in the marketplace. And so we review all of the claims that were received over the past year to ensure that our members are not falling behind the marketplace based on what is actually being charged. And so this year, we're updating 5 services, the costs that we cover for 5 services for acupuncture treatment, athletic therapy, naturopath assessment, naturopathic treatment, and osteopath. And finally, the biggest change that we're making this year is we are implementing a new emergency travel provider. Starting November 1st, our new travel underwriter is Beneva. Beneva is a relatively new company in the Canadian marketplace, and they are a combination of 2 other companies that merged. SSQ Insurance and La Capitale merged and formed Beneva. So we have some familiar faces there. We've met with them and they seem like great people, but they're only the underwriter. They handle the insurance side. The travel assistance provider, the people that our members are actually going to be interacting with, is AXA Assistance. And they are another familiar name to a lot of our members. And we've always had very good experience with AXA and are looking forward to working with them again. We have a new website. We hope you've had an opportunity to visit arta.net. It's completely redesigned. It looks nothing like the older website. It's very clean, and it's very easy to find things on this website. It has a robust search capability. You can type almost anything into the search bar, and there's a great likelihood that it's going to send you directly to what you are looking for. It also complies with all current accessibility guidelines. And if you haven't had a chance to see it yet, we have a new benefits website as well, artabenefits.net. It provides all of the detailed information that you may be looking for when it comes to ARTA's benefit plans. If you're not yet a member of ARTA's benefit plans, you can compare the plans that are available to you. It will let you know based on a series of questions which benefit plan you may want to look into joining. And then you can actually apply online using the new benefit plan as well. And we have a new perks program. We're no longer going to be using the Boom Group. Instead, we've brought our perks program in-house. So we have more control of it, and we can better access those goods and services that our members specifically want. Anything that, if you want to go in to see what kind of discounts are available to you, you can go under your myarta.net account and look for the ARTA Perks menu bar. And that's it for the presentation. As I mentioned, if you do have any questions, please type them in the Q&A function in Zoom. But if you think of a question after the presentation is over, please send us an email at info@arta.net or give us a call, 855-444-2782. So thank you very much for joining us today. As I mentioned, we're going to stick around and we're going to answer all of the questions that come in. We do have a question asking about the premium increases. Yes, as you've seen, our experience has not been very good over the past year for the reasons that I explained. So we are having to increase premiums starting November 1st. If you have a ARTA account, your renewal statement is already posted. You can look for it there, and it'll show you what your current premiums are, as well as what your new premiums are starting November 1st. We are also mailing a new statement out to everybody. That will be in the mail next week. They're currently being printed, and included with that renewal brochure is a new benefits ID card. And we're sending a benefits ID card for each person covered under the plan. The reason we're providing a new benefits ID card is because we have some new logos with our new travel assistance provider. One thing which is not changing, however, is the telephone number to reach the travel assistance provider. That number is going to be transferred from our current provider to our new provider starting November 1st. So even if you're leaving for a trip tomorrow and you're going to be gone for 6 months, you can still take your current benefits ID card with you, and that number will not change. So if you do have a medical emergency, you can still call the telephone number starting November 1st or later, and you'll be put in touch with the most current travel assistance provider. All right, we had a nice little flurry of questions, but it looks like we got to them. Thank you again for your time and enjoy the rest of your Friday. Take care, everyone.